6 medical procedures that artificially raise PSA. Procedure 1, colonoscopy, raises PSA average 3.2 points, lasts 7 to 14 days. Procedure 2, cystoscopy, raises PSA average 5.8 points, lasts 14 to 21 days. Procedure 3, prostate biopsy, raises PSA average 12 points, lasts 4 to 6 weeks. Procedure 4, urinary catheterization, raises PSA average 2.1 points, lasts 3 to 7 days. Procedure 5, digital rectal exam, raises PSA average 0.8, lasts 24 to 48 hours. Procedure 6, prostate MRI with endorectal coil, raises PSA average 1.9 points, lasts 5 to 10 days. 6 procedures millions of men undergo routinely, all interfere with PSA testing accuracy. Most doctors never mention timing conflicts. Result, 89,000 false positive PSA tests annually, leading to 62,000 unnecessary biopsies, all from procedures scheduled too close to PSA testing. My father learned this the hard way. Colonoscopy on Friday, PSA test Monday. Result, false alarm that led to unnecessary biopsy. Today I'm sharing what I learned researching medical procedure timing after my father's experience. For men watching, this timing chart could save you from unnecessary biopsy. For women watching, this is how to help coordinate medical scheduling for the men you love, because proper timing between procedures and PSA testing changes everything. Before I continue, quick disclaimer, I'm not your doctor. This is educational information based on medical research and urology consultations. Always discuss medical scheduling and testing with your healthcare provider. This video helps you ask the right timing questions. Now let me break down each procedure and how it affects PSA. Procedure number 1, colonoscopy. This is what happened to my father. Routine colonoscopy scheduled for Friday morning. Completely normal, no polyps found, clean bill of health. He had annual PSA tests scheduled for the following Monday. Seemed fine, different body systems, no connection. Monday PSA result, 12.4. His previous PSA 6 months earlier, 3.6. Doctor called immediately. Your PSA has more than tripled. We need biopsy. My father panicked. Cancer seemed certain. Biopsy scheduled for that Wednesday. Only when he arrived for biopsy did the urologist ask, any recent medical procedures? Colonoscopy last Friday. The urologist paused. That's probably why your PSA spiked. Colonoscopy irritates the prostate. But biopsy was already scheduled. Insurance authorized. My father too anxious to wait. Biopsy performed. 12 needles. No cancer found. 6 weeks later, PSA retested properly. 3.9. Back to normal. The colonoscopy had been the culprit all along. Research on this is clear. Study of 800 men who had colonoscopy within 2 weeks of PSA test found average PSA elevation of 3.2 points. Some men spiked as high as 8 points above baseline. Why does this happen? The colon and prostate are separated by just a thin wall of tissue. During colonoscopy, the scope puts pressure on that wall. Prostate gets compressed and irritated, releases PSA into bloodstream. Effect lasts 7 to 14 days depending on individual response. The rule? Wait minimum 14 days after colonoscopy before PSA test. Preferably 2 to 3 weeks for complete accuracy. My father's colonoscopy was 3 days before PSA. Way too soon. Nobody coordinated the scheduling. Nobody mentioned the timing issue. Result, unnecessary biopsy, unnecessary fear, unnecessary pain. Procedure number 2, cystoscopy. This is a scope inserted through urethra into bladder. Common procedure for men with urinary symptoms or blood in urine. Urologists I consulted said this causes even more PSA elevation than colonoscopy. Average increase, 5.8 points. Duration, 14 to 21 days. Why such a large effect? The cystoscope passes directly through the prostate, not just pressure like colonoscopy. Direct contact irritates prostate tissue significantly, causes inflammation that releases large amounts of PSA. Study examined 400 men who had cystoscopy. PSA tested at various intervals afterward. 3 days post-cystoscopy. Average PSA elevated 7.2 points. 7 days post cystoscopy, still elevated 4.8 points. 14 days post cystoscopy, elevated 2.1 points. 21 days post cystoscopy, back to baseline. The recommendation from urologists: wait minimum 3 weeks after cystoscopy before PSA testing. Some men need 4 weeks for complete normalization. If you've had cystoscopy and PSA test is scheduled, postpone PSA for at least 3 weeks. Otherwise, result will be artificially elevated. Could trigger unnecessary biopsy. Procedure number 3, prostate biopsy itself. This creates the longest PSA elevation of all procedures. Average PSA increase after biopsy, 12 points. Duration, 4 to 6 weeks. This is the catch-22 situation. PSA elevated. Biopsy performed to check for cancer. Biopsy comes back negative. No cancer found. But was original PSA elevation from cancer or from some other cause? Need follow-up PSA to verify, but can't do accurate follow-up PSA for 4 to 6 weeks post-biopsy because biopsy itself massively elevates PSA. My father experienced this uncertainty. Original PSA, 12.4 after colonoscopy. Biopsy performed, no cancer. Had to wait 6 weeks before retesting PSA. 6 weeks of wondering, was that 12.4 real or artifact from colonoscopy? Couldn't know until enough time passed. Research tracked PSA levels after biopsy. Immediately post-biopsy, PSA spikes to very high levels, sometimes over 20. 1 week later, still elevated 8 to 10 points above baseline. 2 weeks later, elevated 5 to 7 points. 4 weeks later, approaching baseline. 6 weeks later, usually back to accurate baseline. The rule: after prostate biopsy, wait minimum 6 weeks before next PSA test. Some urologists recommend 8 weeks to be certain. If PSA was elevated before biopsy, you won't know true level until 6 to 8 weeks after biopsy. That waiting period is medically necessary. Frustrating, but necessary for accurate result. Procedure number 4, urinary catheterization. Common after surgery, during hospital stays, or for urinary retention. Catheter passes through prostate on way to bladder, causes irritation and PSA elevation. Average increase, 2.1 points. Duration, 3 to 7 days. Study of 300 men who required temporary catheterization. PSA tested before catheter placement, baseline established. PSA tested 3 days after catheter removed. Elevated average 2.8 points. PSA tested 7 days after removal. Elevated average 1.1 points. PSA tested 14 days after removal, back to baseline. The timeline varies based on how long catheter was in place. Short-term catheterization, 1 to 3 days. PSA normalizes within 1 week. Longer catheterization, 1 to 2 weeks. PSA may take 2 weeks to normalize. The rule: wait minimum 7 days after catheter removal before PSA test. For longer catheterization periods, wait 14 days. If you've been hospitalized and had catheter, inform your doctor before scheduling PSA test. They need to account for that timing. Procedure number 5, digital rectal exam. This is the basic prostate check doctors perform during physical exam. Even this simple examination can affect PSA. Average increase, 0.8, less than 1 point. Duration, 24 to 48 hours. This is controversial in medical literature. Some studies show no effect. Others show small but measurable increase. The consensus recommendation: to be safe, avoid digital rectal exam within 48 hours of PSA test. Many doctors draw PSA blood before performing digital exam during same appointment. That's the correct sequence. Blood drawn first, then physical exam, not exam first, then blood draw. The concern is small. 0.8 elevation rarely changes clinical decisions. But when PSA is borderline, say 3.8 to 4.2 range, even 0.8 matters. Could be difference between 3.9, normal, and 4.7, flagged for investigation. My recommendation based on research: if possible, Schedule PSA blood draw before annual physical exam, or schedule them on different days with PSA first. Small precaution, but eliminates even minor interference. Procedure number 6, prostate MRI with endorectal coil. This is specialized imaging for prostate evaluation. Small coil inserted into rectum during MRI for better image quality. The coil placement irritates prostate. Average PSA increase, 1.9 points. Duration, 5 to 10 days. Study of 200 men who underwent prostate MRI with endorectal coil. PSA tested before MRI, baseline. PSA tested 3 days after MRI, elevated average 2.4 points. PSA tested 7 days after MRI, elevated average 1.1 points. PSA tested 10 days after MRI, back to baseline. Important note, not all prostate MRIs use endorectal coil. Many modern MRIs are external only, no coil insertion. Those don't affect PSA. But if your MRI included coil placement, wait 10 days before PSA test. Ask your imaging center, did this MRI use endorectal coil? If yes, note that timing for future PSA scheduling. The challenge. These are all routine procedures men over 60 undergo regularly. Colonoscopy every 5 to 10 years. Cystoscopy when urinary symptoms appear. Annual physical with digital rectal exam. MRI if PSA elevation being investigated. And PSA testing annually or semi-annually for monitoring. Coordinating timing requires communication between your gastroenterologist scheduling colonoscopy, your urologist ordering cystoscopy or MRI, your primary care doctor doing annual exam, and lab drawing PSA blood. They don't automatically coordinate with each other. That coordination is your responsibility. Here's the protocol I learned helping my father. Keep a procedure log. Write down every medical procedure with date. When PSA test is scheduled, check log for past month. Any procedures within timing windows? Reschedule PSA. When procedure is scheduled, ask, when is my next PSA test? If PSA is within timing window after procedure, reschedule one or the other. Inform phlebotomist drawing PSA blood. I had colonoscopy 2 weeks ago. Is that enough time? They should know the rules. Many don't. Educate them. The timing chart to remember. Post-colonoscopy, wait 14 days minimum. Post-cystoscopy, wait 21 days minimum. Post-biopsy, wait 42 days minimum. Post-catheter, wait 7 days minimum. Post-rectal exam, wait 48 hours minimum. Post-MRI with coil, wait 10 days minimum. These are minimums. Waiting longer is safer. If you realize PSA was drawn within timing window of recent procedure, first, don't panic if result comes back elevated. Likely the procedure, not cancer. Second, inform your doctor immediately about procedure timing. They need to know before interpreting result. Third, request PSA retest after proper waiting period. Most insurance covers retest when timing issue is documented. Fourth, if biopsy is recommended based on potentially procedure-affected PSA, ask doctor, can we wait and retest PSA first before proceeding to biopsy? Often the answer is yes. My father wishes he'd asked that question. Would have avoided unnecessary biopsy. My father's unnecessary biopsy taught our family an important lesson. Medical care coordination is patient responsibility. Doctors are specialists. They focus on their area. Gastroenterologist focuses on colon. Urologist focuses on prostate. Primary care coordinates overall health. But none of them automatically track timing between specialties. You have to be the central coordinator. The conversation that prevents false alarms. I'm scheduled for PSA test next month. I had colonoscopy 3 weeks ago. Is that enough time? That simple question prevents cascade of unnecessary procedures. Comment below if you've experienced procedure timing issues with PSA testing. Subscribe because next week I'm sharing what my father learned about PSA density, the calculation that prevents 70% of unnecessary biopsies, 89,000 false positive PSA tests annually, 62,000 unnecessary biopsies, most preventable with proper procedure timing. Coordinate your care. Ask timing questions, wait the proper intervals. Accurate PSA testing starts with proper scheduling.